Good morning, everyone. Kwe, bonjour à tous et à toutes. Algonquin College would like to acknowledge that today's event is taking place on the unceded and unsurrendered territory of the Algonquin people. Traditionally known as Anishinaabe, Algonquin people are the original inhabitant of the wide expanse of territory along the Ottawa River. So good morning, everyone. My name is Claude Brûlé. I'm the president and CEO of Algonquin College, and it's my distinct pleasure to be your host for today's virtual Future of Health and Wellness speaker series. As I've mentioned at previous events, many of us have had to change the way we do business, and we've done so for the past year and a half. And this also applies to how we run events as well. Unfortunately, we're not hosting this event at our on-campus restaurant today, where previously we would have normally eaten a wonderful, delicious breakfast prepared by our students. However, we want to make sure that we continue these health and wellness dialogues with our community. So here we are. Just want to make sure we go through a couple of housekeeping items before we get started. And we've changed to our platform to a webinar. So this means that you can see and hear us, the panel, but we cannot see or hear you, the attendees. So if you have any general question or you need technical assistance, please feel free to use the chat feature, and our events team will help you with any challenges you might be experiencing. And we also encourage you to use the chat to spark conversation with everyone else here today. If you have a question for our speakers, there are two ways you can ask. You can raise your hand in the participants tab, and I will call on you to speak. You will need to unmute yourself, and then you can engage with our speaker. Or you can ask your question by typing it in the Q&A feature, and I will read it out loud. Also, feel free to share the conversation on social media using one of the two hashtags we have, hashtag ACHLE and hashtag ONHealth. That's ONHEALTH. So here we are with a slightly modified format for our virtual Future of Health and Wellness speaker series. This event continues to be the place to share ideas, spark conversations, and discuss matters of relevance to the future of health and wellness across our community. And before I go any further, I would like to acknowledge the presence of a number of community stakeholders who have joined us this morning. From City Council, we have Keith Eagley, Councillor for Ward 9, Knoxdale, Maryvale. Welcome, Keith. We have a number of Board of Governors from Algonquin College present this morning. Andre Obonswin, Audrey Lawrence, Stephen Tudor, Val Seya, and our board chair, Jay McLaurin. Welcome. I also note that we have a number of people that may have registered from our two partner for this speaker series, partners from Ottawa Public Health and from Briere. And so welcome to all of you. So let's get started. We're honored to host Dr. Sarah Funnell, founding director of the Center for Indigenous Health Research and Education in the Faculty of Medicine at the University of Ottawa. There are several topics that I will be discussing with Dr. Funnell, and today we'll be encouraging you to ask questions throughout the discussion. To set the stage, today's discussion will be more of a fireside chat between myself and Dr. Funnell, where she will be exploring the root cause of Indigenous health inequities and how community leaders can be allies. So first, let me introduce Dr. Sarah Funnell for you. Dr. Sarah Funnell is a First Nations family physicians, and public health specialists. Sarah is an associate medical officer of health at Ottawa Public Health, and she's also director of Indigenous Health within the Department of Family Medicine at Queen's University, where she is today. Apparently, she's teaching later today in Kingston. Previously, Sarah offered primary care services for refugees, immigrants, homeless, and Indigenous people. Since March 2020, Sarah has directed her attention towards supporting the COVID-19 response and advancing Indigenous health medical education. There's also an interesting connection to Algonquin College. I'd like to mention that Dr. Funnell's father, Simon Bracoupé, is an alumni of our advertising program. Simon is a Kijigan-Zibi Anishinaabe artiste living in Algonquin territory, right here in Ottawa. Well, thank you for joining us today, Dr. Funnell.
Miigwech.
Wonderful to have you with us. And all the way from Kingston, as I understand, this morning as well.
Yes, and I do wish we were sitting beside a fire because it's quite chilly here in Kingston today.
It's a fireside chat, but unfortunately we don't have a fireplace in the background for us. Well, let's get started. So from your perspective and your research, Sarah, what do you think are the root causes of Indigenous health inequities?
So as you said, I'm in Kingston doing some teaching, and I was teaching yesterday. And what I like to do with medical learners, medical students, residents, faculty, I taught some faculty yesterday, is we start to think about what are some Indigenous health inequities that people are aware of. And, you know, I get their brains flowing and I hear things about higher rates of diabetes, higher rates of suicide, higher rates of infant mortality, lower life expectancy. And then we unpack that. And so when you think about it, for example, infant mortality. Infant mortality is a measure of a community's health. And so if Indigenous babies are more likely to die than non-Indigenous babies, why is that? And so we unpack that. And I hear lots of things about access to healthy foods, housing, prenatal care, or racist-free, bias-free care. And in the end, we get to things like colonialism, a sense of Eurocentric worldview is superior to Indigenous ways of knowing and being. And then, I keep asking them, why is that? Why do you think that we're in this situation? And we ultimately always get to racism, which is about power and control over people. And then we unpack that and but there's more to that here on Turtle Island, because there's many people, Indigenous, Black people, people of color that experience racism, which is power and control over racialized people. But in the Canadian context, it's very unique because it's power and control over Indigenous people and our land. And so we are all here, we all recognize that Turtle Island is so beautiful. I'm looking out of my window here in Kingston, and I see a beautiful waterway, the St. Lawrence. You can imagine why people would want to settle here. It's very clear. Not to mention our lands are full of resources, rich resources, and you can see how that's playing out today in politics. Mm-hmm. But those are the root causes when you start to unpack that. And so then the conversation turns to, well, what do we do about that? And I never want to leave a learner with that feeling of hopelessness, that they don't have agency to make change, because together we can make change collectively.
Absolutely. And your learners are responding well to contributing to that agency?
Well, yes, and I recognize that these conversations and discussions and emotions that rise up are difficult, right? So, you know, for example, I'm here in Kingston, which Queens acknowledges is the traditional territory of the Anishinaabe and Haudenosaunee peoples. But what does that really mean, right? So when I grew up near Kingston on Alderville First Nation, I was taught about the Loyalists and how, and that was a source, if you can believe it, a source of pride for me, that our nation was built on people that were loyal to the crown. But there's a counter narrative to that. And in the Kingston area where loyalists settled, this land was Anishinaabe land. It belonged to the Mississaugas. And so they ended up needing to be relocated because the loyalists were provided this land for their loyalty. And so these two thoughts can be really difficult to hold at the same time, that we're at one hand proud of the origins of what is now called Canada, but at the same time acknowledging that this nation was built on colonialism and racism, and that there's been intergenerational effects of that to today for Indigenous people. The First Nations, Inuit, and Métis peoples are still affected by that. And those two competing thoughts are really difficult to hold. But two realities can be true at the same time. And so I encourage people to just sit in that discomfort, because when you do, you get to a different place. And so that's, I think it's important to acknowledge that holding those two competing thoughts at the same time is difficult for people.
Difficult and necessary, frankly, to your point about the past and being able to reconcile with that.
Yes.
Yeah, indeed. Well, thank you very much for those opening comments to that first question. As we said in our introductory comments, the floor is open for our attendees to ask questions throughout. And there are two ways that you can do that. You can put up your hand, and I have the list of attendees before me, and I can spot you, and we'll call you, and you can unmute, and you can ask your question. Or alternatively, you can go to the Q&A. We have a Q&A feature at the bottom here, and you can type in your question there, and I will read it out for Sarah to answer. We'll just wait a second here to see if we have any questions from our audience. Okay. Not seeing any just yet. Oh, we got one here. Let's go to Ian Pinot. Go ahead and unmute, and you can speak with Sarah.
Am I good there? Can you hear me, Claude?
Yes, I can, Ian. Thank you.
Okay, great. Hi, Sarah. A question around dealing with the health issues. In your perspective, are we better off to look at having the Indigenous nations take care of their own health and finance and roll out Indigenous health systems? Or is it best that we sort of combine the two, what we have now, with an Indigenous way of knowing and an Indigenous health system, and have those combined and possibly reap the best of both worlds?
That's an excellent question, and I don't have a simple answer for that. So as anything that's really complex like that requires multiple complementary strategies. So when we, and it's an excellent question, because when we unpack the root causes of the health inequities, health and wellness and mental health inequities that we see today for Indigenous people, it's the direct result of that removal of self-determination. So under the United Nations Declaration of the Rights of Indigenous People, which Canada has signed on to and is developing steps towards that Indigenous people, as Indigenous people, we have the right to determine for ourselves what we need to be well and how that's carried out. So, so back to your question, how do you operationalize the UN Declaration of the Rights of Indigenous People? As as many of you know, and if you don't know, it's worth exploring, that Indigenous people on Turtle Island, we're a diverse group. We're comprised of First Nations peoples, both living on and off reserve to make it more complicated. Some people have legal status under the Indian Act, some don't. There's Métis peoples, which is an incredibly beautiful culture, and not to mention the Inuit, also beautiful cultural traditions and principles of well-being. And so there's going to be no one size fits all model. So I think what you've described, Ian, is a journey. And Senator Murray Sinclair describes this journey really well when he talks about the Truth and Reconciliation Commission's calls to action. And in my world, I think about health and justice. And so he says, the commissioners described the way up a mountain, right? It's a mountain that we need to climb. As Ian, in your thoughtful question, you've described, it is a mountain. And it's up to all of us, a collective all of us, to figure out how to get up that mountain and do it together. So there are, so simple answers. There are some Indigenous communities that are ready to take on their own healthcare system. They just need health human resources, as we all do everywhere, and financial resources and bricks and mortar to get that done. There are other communities that aren't ready for that, but at the very least, and all in between, right? But at the very least, when providing healthcare services or developing programs, we need to employ a nothing about us without us approach in any program or service that's being put into place. And so as a Western trained physician, I've spent many years becoming a licensed physician in Ontario, and others like me, we do have that sense of we know what's best for our patients and our communities, but we have to hold back on that because we might think we know best. As we could see in the residential schools, people thought they knew best, but it can end tragically. And so if we do employ that nothing about us without us approach, so we ask the communities what they need, we can avoid making those same mistakes again. Yeah, it's a really thoughtful question, and it is difficult to answer. The nothing about us, as Ron McCluster has put it in the chat, was articulated in the Royal Commission for Aboriginal Peoples before the TRC. So there's been commissions before the TRC that described a route up a mountain. And so, what can we do today to really make action? And the very simplest thing to start with is a nothing about us without us approach. Miigwech, Ian, for your question.
Thank you very much, Ian, for your question. Very thoughtful, very deep question, one that we could spend a lot more time on. And thank you, Sarah, for your answer. We have another question in the Q&A, but before we go to this one here, I do want to pick up on something you said around, the determinants of health, and you spoke about racism that contributes to and impacts Indigenous health. And what role does racism play in Indigenous health? And we've seen recently some incidents play out with tragic consequences. I'd like to hear your comments on this.
Yeah, so the way I'm a visual person, and I really like the National Collaborating Center for Indigenous Health, their framework for looking at Indigenous determinants of health. And they describe three tiers of determinants of health. there's the most powerful ones, of which all the others flow from. And they describe colonialism, racism, lack of self-determination as these really powerful determinants of health from which the others flow. And so those which our nation, Turtle Island, is built upon, all of our structures are colonial structures, not all of them, but I think you know what I'm saying, and built on a Eurocentric view. And so from those, we have our systems, our education system, our healthcare system, our legal system. They have direct impacts on the more proximal determinants of health, such as housing, income, education. But the other flows of that, which I didn't describe, is that we have our strengths as well. And so we have positive determinants of health, which have been impacted by colonialism and racism. And so it's about allowing those positive determinants of health, such as language and culture, that can help mitigate those others. But we do need to dismantle the colonial structures. So when you think about it, it's quite incredible, really, that entire policies were created to erase Indigenous culture. The goal was assimilation for Indigenous peoples. And the final step of assimilation is that the group that's being assimilated hates themselves, hates where they come from, hates their culture. And that's called internalized racism. And that's the most sad and tragic form of racism, in my view, that exists, because you can imagine if you hate yourself, hate your culture, hate where you come from, you're not very good to yourself. Yeah. And you don't treat yourself or those around you very well. The way you cope with that can be unhealthy coping behaviors. And so to dismantle that, we need a revitalization of our culture so that we can heal. And so in my conversations with establishing the Center for Indigenous Health Research and Education at the University of Ottawa, Faculty of Medicine, what I've heard is that as Indigenous people, First Nations, Inuit, and Métis people, that we're strong and our culture heals us. And I've heard elders say that too. We have all that we need to be well and healthy. And I've struggled to understand that on a personal level over the years. But as an Indigenous person, I'm starting to understand that and see that more clearly, how my culture heals me and my people around me. I hope that helps explain how race is a powerful determinant of health.
It is, and you picked up on something that I believe not many people in our audience, including myself, would have picked up on, and it's your mention of this internalized form of racism. That we think, broadly speaking, that racism is something that someone does to someone else, and it's that one-sided. But over time, through living in that environment, what you're suggesting is that the person themselves have these feelings that are creating unhealthy behavior, and it's something that really must be turned around. It's not just contributing to decolonization, but also embracing language and cultures as means to help create a healthy environment and more healthy determinants. That's
Absolutely.
very powerful. Very powerful.
Yes, racism is not as simple as we think it is. So there's different types and levels of racism. I've described to you internalized racism and systemic racism. And the one we're most familiar with is individual racism, like hate crimes. But all of those add up to 1,000, a million cuts that influence someone, an individual, and their community around them to contribute to this sense of cultural disconnection. And so the way to heal from that is through culture, I am told, and I do believe that.
Thank you very much, Sarah. Good place to see if our audience has questions related to this very, very powerful little segment we just covered here. We see some things in the chat here. Ron is talking about the internalization in his family. Yeah. And if anyone has a live question they would like to ask, please feel free. Again, you just put up your, raise your hand, and I'll call you up, and then you can unmute, and you can ask your question live. We do have a couple of questions here. One we'll touch on in a moment. It's pandemic related. I've got another one here from Jeff Haggett here, who asks, as an educator and a former student, what do you see as the role of an Indigenous student center in on a post-secondary campus? So I think most post-secondary institutions, university or colleges would have a center that's really there to assist and support Indigenous learners. And so from your perspective, Sarah, what do you see as the role of that Indigenous student center?
Oh, that's an excellent question. We know that we're in this era of EDI everywhere, equity, diversity, and inclusion. And that inclusion piece, to be the one Indigenous student in a class, whether that's, a undergraduate class or medical school, or a medical training program, or any learning environment, that as well as the leadership levels, that inclusion is like having a seat at the table, where as an Indigenous person, you are adapting to that colonial structure. It doesn't mean that we've reached reconciliation in any way. And it doesn't mean that we've checked all the boxes to ensure that we're doing the right thing. It's likely a good first step, provided that the academy does have this sense of belonging for their students and faculty and support staff, right? So when you think about a welcoming academy, what creates a welcoming academy for students and learners? And it is things like supports in Indigenous student centers, where there's a sense of belonging, a sense of home, shared meals within COVID restrictions, supports for students, whether they're financial or emotional supports. And I think that there are ways that this can be done really well, and that there are ways that it can be done not well. And so I've seen different examples of this across Turtle Island, where it's done well, where there's, sustained funding for staff members in those centers. Because the worst thing is for people to come in and out, and there's not a continuity of a person that that you can go to. So it does require sustained funding. The bricks and mortars that create that sense of belonging, of that welcoming academy, and places where people feel at home, like in terms of like physical space. So there's the physical space and the social space that needs to be attended to. And I think a really golden example would be if you had resource people from diverse Indigenous backgrounds, so Inuit, Métis, and First Nations, and I think that we'll get somewhere to supporting Indigenous students as they go through their learning journey. It's very difficult and challenging, and having someone there when a student experiences racism in a learning environment that they can go to, and that real action will be taken. So it's not only about spaces, It's about policies that are in place to hold people to account for their actions, whether they're another student or a teacher, support staff. That needs to be in place too to support learners, and that a whole faculty approach to learning how to create a culturally safe learning environment is essential as well. So ensuring that there's some mechanism for all faculty to learn and understand about colonialism and our history here in Canada. I've seen in the OPH example, the whole senior leadership and the board take Indigenous cultural safety training, and they were changed forever by that. And that's incredible. And so that whole faculty approach, starting at the leadership of this type of training, you need all of those things to really create an academy where people feel they belong. And it doesn't take away anything from non-Indigenous students. We have to keep that in mind when we build a healthy healthcare system or an education system that addresses the TRC calls to action. It really doesn't take anything away from non-Indigenous students. In fact, it improves the experience for everyone.
Indeed. And you mentioned leadership at Ottawa Public Health that really embraced this. And I'd like to recognize Dr. Vera Etches, who's joined us now from OPH and is here in our audience. Her leadership at the helm of OPH has been tremendous throughout the pandemic. And as you mentioned, to establish training to create that cultural safety environment for everyone. So thank you. Thank you, Dr. Etches, for joining us this morning. Now I had Ron McLester had his hand up, but let's see, when is it there? Yeah, Ron, go ahead.
All right, can you hear me okay?
We get a bit of an echo.
Yeah, I think I took care of it. Is that better?
Yeah, it is.
Okay, perfect. Sarah, thanks so much for everything that you've contributed. I have a question to build on what Jeff Agate had said. I've been working in post-secondary education around Indigenous for about 22 years or so now. And I'd like to expand on what Jeff had asked around student centers. First, I think a bit of a baseline, which contributes and sort of just cements some of what you've said. You know, we're all byproducts of colonization, regardless of who we are, where we come from, our ancestry. I happen to be Oneida of the Haudenosaunee and work up at Algonquin now. And so my question isn't really Algonquin College focused. And again, I preface by saying that I've been in this sector for a long time and worked at 7 other post-secondary organizations. But in 1991, when we started getting the ETS funding, a lot of folks installed Indigenous student support centers, which basically are, you know, at that time had become reserves on campus, right? It was a special place where the Brown students go, and it often had the stove with one working burner and the chairs that were ready to fall apart and all of those kinds of things. You know, we've come a long way since then. And, you know, in the era of truth and reconciliation, and like you say, EDI, I wonder what the next evolution of those support centers are. At all of the organizations I've worked at, we only service between 5 and 15% of the self-ID'd and other, because there's really about half of students, you know, don't self-ID for whatever reason. And so at the best of time, those centers are servicing a very, very small amount of Indigenous learners at any particular institution. Additionally, like I say, we're all byproducts of colonization, and in our population that manifests or presents in specific ways, often mental health, often poverty, often substance abuse, many other things. But I find that, you know, those kinds of centers often create a bit of a gravity well for that certain type of presenting of the impacts of colonization. And so if we can agree that we are servicing a small amount of the Indigenous learner population, and we can agree that we're at a time of increased equity, diversity, and inclusion, you know, BIPOC, Black Lives Matter, indigenization, what do you think the next iteration or the next evolution or the next way of looking at Indigenous student support centers that might sort of break that old mold, perhaps try to service additional learners, but also be of benefit to the average Canadian who's looking to contribute to the discourse around reconciliation and indigenization. Thank you.
Thank you for your question. It's almost like you've given me a canvas to describe like the ideal student supports. So I recently read a paper that described this framework that goes from there's a continuum from inclusion, which I think many, if not all, academies are embracing, to reconciliation, which is power sharing, and at the ideal end, it's self-determination, where you have Indigenous academies. So there's that, and how do you get there, right? We're not in a place right now all over Turtle Island to create Indigenous academies, or maybe we are. But I think to your question about who seeks the services and how do you improve that, it's really hitting home for me. And I was just talking to an Indigenous colleague here in Kingston yesterday about this, because here in the Faculty of Health Sciences, you know, a certain number of students identify as Indigenous, yet only a small fraction of them end up at the student center. So why is that, right? And that's your question. And I think we don't have a clear answer for that. I can speak from my own perspective. When I was an undergraduate student in the 90s at the University of British Columbia, some of you may know they have a beautiful lodge, longhouse, the UBC Longhouse. And it was odd for me. It was sort of stuck within this academy, and I didn't know how I belonged there. And I never went to the student services at all. And I was a young person trying to fit in. And I had learned over the years that it was best not to self-identify, because that was hurtful and harmful. And so perhaps if we unpack that, in my experience, that there was more that needed to be done to create that sense of belonging, that I could be who I truly was at that time. So I think sometimes we, at least in my conversation with my colleague here yesterday, we were sort of, you know, the sense was that, well, let me say it this way, because I've been told this, that idea, build it and they will come, doesn't work in this context. And so how will we know what will work if we don't ask? You know, perhaps if someone had asked me, what do you need to be successful in your undergraduate medical education? Feast it and they will come. Well, I think there you go. It has to be you have to ask yourself why you're doing it, right? Like, we want to support students so that they'll be successful. What they need to be successful. And what I needed as an undergraduate student was some confidence building, in a sense that I belonged in that place. But instead, I didn't have that feeling and adapted myself to that place. That was assimilation and internalized racism at play. So it's not easy. It's not easy. And Ron, I saw in the chat your earlier question about language and it not being passed down. And, you know, like I said, my grandfather, his first language was Algonquin, and then he learned French, and then he spoke English. And Algonquin and French were not passed down to my family. And I'm sad about that. And so, you know, I asked my dad, why weren't those languages passed to us? And he said, it was because his parents didn't want the children to experience any additional racism with regard to their language. So those are pretty strong words. And I see that, Ron, you also had a similar experience where our parents wanted us to survive in this world, and so hid some of our culture so we could. But there's been wise people that held on to this culture, and now and over the last few years, there's a revitalization of our culture because it's been kept, often hidden by people. So that's a long-winded answer, and it is. So you can see that some people, on the other hand, did find these centers, for Emily in the chat, as a safe haven. And so, you know, I wonder if there's some best practices across there that could tell us what are the strategies that need to be in place to support Indigenous students.
Yeah.
And for myself at that time, there was probably some more elements of building confidence in me and some sort of support that could have helped.
Indeed, and perhaps some of those best practices, as you said, Sarah, were built on asking first, you know, and creating an environment that was co-created, not one-sided, but again, using the concept of nothing about us without us. And that may have led to creating some elements that were well received because those were the things that were needed. So fantastic.
Yeah, at the same time, I can't not say that when I applied to medical school at UBC, and I wasn't accepted, I wasn't offered an interview. I had a difficult time in university. My mother passed away, and I struggled with that. And so when I applied to medical school, the Indigenous program, the coordinator there has said to me, "Oh, yes, sorry, you're not being offered an interview," but provided me some advice, which changed my life forever. In fact, and I tell people that not getting into medical school the first time was the best thing that ever happened to me, because I ended up pursuing further education in social sciences at Carleton, in Canadian studies and legal studies, and it did change my life. And I learned a counter narrative of Turtle Island, and as an Indigenous person that I never had heard before in my education, about how this nation was built. And the lights just went off for me, and I could see my whole life flashed before me, and all those times, those thousands of cuts that I experienced, even on the playground, even waiting for the bus in elementary school, all of those things I was able to identify as racism, and it absolutely changed my life and contributed to me becoming a public health physician. And so I don't know, that was a great example of Indigenous student support, I think. And I'm forever grateful to that person who I get to see later today to again thank them for that.
Wonderful, wonderful story. Thank you for sharing that personal story, Sarah. We had another hand up, but I'm not sure. Some hands go up and some hands go down. So I'm just going to say, all right, Andre Obonswin. Go ahead, you need to unmute.
There we go. I just got the mute button. More of a comment and
sorry, Andre, you'll need to speak a little louder.
Oh, sorry. Can you hear me now?
Yeah.
So more of a comment and a thank you for your great response, Sarah, and great insight what Ron was sharing. I'd just like to make a comment on the students and how I see a change in our Indigenous youth being more active, more vocal, and want to do more support for their own peer students, Indigenous and non, and be very good representatives of their own communities. So I think if we can find more ways to give them the tools in post-secondary to be able to explore these opportunities, we'll see a greater change in the participation rate as well into a lot of the college's event, even in their classrooms. So hopefully we'll get to that place where we have more folks like yourself that can help our youth, but our youth will become the voice for our community members as well. So thank you very much for today.
Well, thank you. And I'm Generation X, and so I'm learning more about generational intelligence, and that generations come with their own sort of, worldview because of how the world has shaped them. I have 3 children. They're 14, 12, and 10, and you're absolutely right. They teach me about language, gender. It's incredible what they know compared to what I knew, and that sense of social justice at such a young age, not at all where I was at that time, and it's incredible. They're also angry. I say to them, it's your generation. You're gonna. I know that you're going to fix the problems of climate change, and they are angry at us for not thinking of them in the actions that we take. So you're absolutely right. Our youth is our future, right? Children are sacred. It's absolutely, your comments are really hitting home to me with 3 young children, and my daughter just started high school, and there's an Indigenous liaison person for her. It's an Indigenous person in her high school. She's finally in a school with other Indigenous students. There's that sense of belonging that she didn't have before. So that's really incredible. And where gender diversity is the norm, incredible. So you're absolutely right. Miigwech for your comments.
Thank you, Andre. In our last, whoops, sorry, I'm at work here and the lights automatically go off once in a while. In our last few minutes, Sarah, and I know we could spend a whole lot of time on this, you mentioned Senator St. Clair earlier on, and for his tremendous historical leadership in the eventual crafting of the 2015 Truth and Reconciliation Commission report. 94 recommendations in total, many of them related to health and justice, as you mentioned. What can be done at organizational levels and for community leaders to take action, or to address, or to advance health-related calls to action from that commission report?
So it's an excellent report that's described the way up the mountain. And your question is, how do we as leaders or of organizations, if you're out there, whether they're big or small, collectively make a difference? I have an excellent example, and it's from my work at Ottawa Public Health. And as you've acknowledged that Dr. Vera Etches is on today. If you're still there, I want you to know that you're a true inspiration in personifying a nothing about us without us approach. We developed a reconciliation plan with local Indigenous elders to address the TRC calls to action on health. And over the years, we then built a evaluation framework with indicators so that we can see if we're making a difference. We employed Indigenous consultants in the area. Now we've hired an Indigenous evaluation specialist, a local, another Algonquin person who's fantastic, to measure in a 2-eyed seeing a two-eye seeing approach, both, bean counting, how many people have taken cultural safety training, but also a reflective piece. What did that mean for you? And how did that change you? And so with those conversations, we have talking circles with an Indigenous facilitator, with our staff, to ask them, these questions and honoring Indigenous ways of collecting those reflections. We also meet with our external Indigenous organizations often. And I think the most beautiful example of reconciliation in action, that power sharing model with OPH and the Indigenous service providers, is the vaccine clinics, where OPH and the Indigenous organizations have partnered in that power sharing way to provide a COVID vaccination program for Indigenous people. And as an Indigenous person with children who's attended those, it really was an amazing and beautiful experience. Those clinics, operated with traditions, honoring the vaccine in a traditional way. It was just beautiful form of reconciliation in action. And so, there's also this idea of reciprocity. As an organization, we want to create world-class programs and services that honor Indigenous peoples. And we know that as an organization that hopes to become and aims to become culturally safe and humble, that we need to hear from our community if we're achieving that, but that we just don't take, that there's a reciprocity. It's a give and take, and honoring that, whether it's financial honorariums for elders and their knowledge, or some other form. It doesn't have to be always financial. There's other ways to give and take, as we've seen with the COVID-19 vaccine clinics. And so you do need to work with the community to establish what we should be doing to improve our work, and then measure to ensure that you've done it. And if you haven't, go back. And it's an iterative process to improve whatever it is that your organization does, and to evaluate it. And as much as possible, employ Indigenous people either as employees and support them as we talked about students, but also Indigenous consultants and people in the community, so you can demonstrate that you really mean reconciliation.
Indeed. So well said, Sarah. Thank you very much. And I love your term about the need for reciprocity. It is so fundamental in creating reconciliation in action. And I think that's a great term. It cannot be passive. We need to couple words with meaningful action. So this great example that you've given us through the COVID-19 vaccination clinics.
I should likely also mention that since the TRC calls to action have been released, we have a new inquiry that is worth paying attention to as well. It's Reclaiming Power in Place, the inquiry into the missing and murdered Indigenous women and girls, which has several calls to justice. And we've recently updated our reconciliation plan at OPH to include those calls to justice in that report. And I'll highlight that trauma and violence informed care is critical, likely in all of the work that we do, and create a sense of safety and belonging for Indigenous people. So that's another mountain, additional steps to get to that mountain that are really critical to acknowledge as well.
Indeed. Thank you very much, Sarah. Well, we've come to the end of our time together. I can't believe how quickly an hour has gone by. We could spend a day together and still just being scratching the surface of what there is to talk about as it relates to Indigenous health in this country. We've covered root causes. We've talked about determinants of health and how racism affects those. We've talked about support for learners and what does that mean and how this will evolve over time. And we've talked about the concept of inclusion, deep inclusion, nothing about us without us, and how together we climb this mountain and address all of these recommendations that were so eloquently put as an imperative call to action from the 2015 Truth and Reconciliation Commission report. So thank you very much, Dr. Sarah Funnell, for being with us this morning. We really appreciate you joining us, sharing your insight, your knowledge, and your personal stories. It was really meaningful. It gave us a lot to think about, and I know this conversation will carry on beyond this hour. So this concludes our time together, folks. You will note that this presentation was recorded, as all our others have been, and they're available online. You can find them on the Algonquin College Healthy Living Education website. And if you have trouble finding the link, send us an email. We'll be happy to help you. I would like to thank you, our audience, for starting your Friday morning with us, and I look forward to seeing all of you back soon. Thank you. Miigwech. Merci.
Miigwech.